Let's talk about things that actually matter to your and my health, our families, and that's the NHS. NHS boss, effectively, the Health Secretary Wes Streeting, has announced that basically if you're an NHS Trust and you don't deal with waiting lists, you ain't going to get a pay rise, and you're probably going to end up getting sacked if you don't do your job properly. We should all welcome this, shouldn't we? Well, let's put that to Stephen Dorell. He's a former Conservative Health Secretary and former chair of the NHS Confederation, now a Liberal Democrat, I need to point out. But Stephen, thank you for joining us, and what do you make of what Wes Streeting has announced?
Well, to be honest, rather underwhelmed, Julia, because you're right that he says that managers should be responsible for the results they deliver and they shouldn't be in post if they don't deliver results. And nobody's going to disagree with that. The bigger thing that he announced or set out to announce is enhanced freedoms for trusts and hospitals to manage their own affairs. Well, I was a member of a government that announced exactly that policy almost exactly 35 years ago. So it's not exactly news.
Yeah, there is that. I mean, what I find, though, is we go through this circular process with government, and particularly when it comes to NHS, was it should be local people that decide, and we need local managers and empower them. And then, of course, when things go wrong, we need to have it's a postcode lottery of care. We need to have central control. And we just swing one way and then we swing the other. But the main thing comes down to we need people who are good at managing to be managing the NHS. And given that we have such long waiting lists, and we have a situation where one hospital with similar demographics and the same budget can achieve much better outcomes than another one. By definition, there must be people who are in management jobs in the NHS who, frankly, aren't very good.
Well, of course, the NHS employs 1.5 million people, so there will be people who underperform, of course, in any organisation.
But when you underperform in the NHS, people die.
The bigger question is, if you look at a hospital on its own as an island, you will never be able to deliver good performance in a hospital if you haven't got surrounding the hospital GPs that are doing their jobs, social care that is doing its job, the community services that are doing their jobs, holding a hospital manager to account for failures of a healthcare system is in danger of shooting the wrong person
because they have no say.
Fundamental questions of the surrounding health economy.
Well, it's the local council that's in charge of a lot of that social care, isn't it? And of course, they haven't got any say over GPs a lot of the time. GPs are, to intents purposes, private contractors. But here's the thing: the health secretary isn't just a health secretary; it's a health and social care secretary. This changed quite a long time ago. It's supposed to be all about emphasis on social care. The last Tory government, they talked an awful lot about more money for didn't they, for social care? Never actually materialised.
Boris Johnson told us he had an oven-ready solution.
Oh yeah, back in July 22, wasn't it? No,
2019, when he became Prime Minister.
Yeah. I mean, again, this thing, but everyone talks good game on this, but we all know we can't resolve the issues in the NHS unless we resolve social care. And we know it's going to cost money, but it'll cost a damn sight less than the money we pour into hospitals. So why does no one get to grips with it when everyone says we know what the problem is?
Well, because it's more difficult than making a speech, is the short answer. It's hard. You've actually got to get into the detail, work through with individual local authorities, with individual care providers in the community, with the GPs, and you've got to work out where the priorities are, avoid people going into hospital when they don't need to go into hospital, get them out of hospital when they don't need to be there anymore. And instead of promising to build more and more hospitals, use the hospitals we have as part of a joined-up system that delivers better care.
It sounds so simple when you say it, and yet no one ever does it. There is an issue, though, with some management of hospitals. We know this because there are hospitals that are failing, and then new management is put in, and things improve. So we do know there is a hospital management issue, but I know you'll also know from many years working in this world, and I've for many years reporting on this, is that actually people who fail, and it's the same as teachers who fail, they just kind of get a payoff, shoved off, a half-decent reference, and then they go and work somewhere else. We've got to get these people out of the system entirely, haven't we?
I do agree with that, but I've also been around long enough to know that it's too easy, as I said, to shoot the hospital manager when actually what's happened is that in a particular locality, social care isn't working, GPs aren't working, community health isn't working, and the problem manifests itself at one point in the system. Of course it's true that people should be held to account for delivering results. Of course, that is true. But what you shouldn't be doing is holding one person to account for failures that they, in truth, are unable to deal with.
OK, very fair points. Really interesting to hear from you. Stephen Dorell, there, former Health Secretary himself. Thank you for that. Benedict Spence, he's got a fair point there. But again, we can't constantly go through life going, well, I mean, no, I'm not responsible for everything that happens. So it's like Justin Welby. I don't have to resign. It wasn't me, Gov. At some point, you have to be held.
I mean, if you go through everybody's individual cases for why things aren't working, I'm sure they'll all give you very good excuses. But when you look at the system in the round, you go, OK, well, people are dying as a result of the fact that, that it's not working properly. So whatever individual excuses you can come up with, great. Work on improving that. And if you don't, and if it's constant just excuses, oh, this is the problem, that's the problem, it's nothing to do with me, well, you're not actually going to improve anything. And actually, it is right to get rid of those people.
And again, if the problem is that they can't be held accountable because they're not in charge of it, well, then change the system. And again, changing that job title for the Health Secretary to Health and Social Care Secretary a few years back hasn't seemed to have done anything to actually improve social care.
Changing
by the
words,
way,
the
way, the brilliant idea of sacking tens of thousands of social care workers because they wouldn't get a jab they didn't need for COVID.
Oh, yes,
Perhaps didn't help as well. It always comes back to COVID, always does.